Hello everyone, I am Beatrice. In today's video, we'll be looking at the GTPAL system. This is a standardized way of recording or documenting a woman's obstetric history. So when a woman conceives and comes for antenatal, nurses and midwives, the obstetrician, they use this GTPAL system to document, to take history of the pregnancy. It's a way to know the outcomes of previous pregnancy and how to also manage the current pregnancy. So this is essential for clinical practice. It's also essential for your exams, especially the nclex exam. So we'll be reviewing this GTPAL and we'll look at some examples. We'll solve some examples together. So if you're ready for today's video, let's begin. Now first, let's look at the full meaning of GTPAL because it's an acronym. The G stands for Gravida or gravidity. The T stands for term birth. The P stands for preterm birth. The A is for abortion, or we can say miscarriage. And then the L is for living children. First, the Gravida or gravidity. So this refers to the total number of pregnancies regardless of outcome. So it includes both the current pregnancy, also because we're saying regardless of outcome. So even when a woman had miscarriage or abortion or stillbirth, including the one that are living all together, has this woman ever been pregnant? How many times this woman has been pregnant? Now another thing you need to know is that for multiple gestation, so let's say a woman had twins, triplet, quadruplet, and as many, is counted as one. You are just saying how many times you have conceived, not how many babies is there. So that's what Gravida or gravidity stands for. Now the next one is term birth. So term birth is talking about the number of pregnancies that are carried to term. So what is term? It's about 37 weeks to 42 weeks. So if the pregnancy ever got to 37 weeks upward, we say it's a term birth. So that means if a woman carried pregnancy for let's say 38 weeks, 39 weeks, 40 weeks, and so on, we say it's a term birth. Now the next one is preterm birth. So for preterm birth, we're looking at the number of pregnancies that were delivered between 20 weeks to 36 weeks of gestation. So meaning if a woman carried a pregnancy for 36 weeks, let's say 6 days, not up to 37 weeks, we're still going to count it as preterm. As long as the pregnancy did not get to 37 weeks before the woman delivered the baby, we call it a preterm birth. Now the next one is abortion or miscarriage. So this one has to do with number of pregnancies that ended before 20 weeks of gestation, whether it was elective or whether it was spontaneous. But as long as that pregnancy did not get to 20 weeks before it got terminated or before the woman loses it, we are calling it abortion or miscarriage. The last one is L for living children. So it's just as the name is living children, the number of children that are alive. Now take note, for these living children, multiple gestation will count individually. So let's say a woman has been pregnant once, but that pregnancy resulted to triplets and the triplets are alive. So when we are counting living children, we'll be counting it as 3 and not as 1. Now let's look at some examples to analyze what we have discussed so far. So the first example, let's bring out the criteria GTPAL. So let's look at the Gravida first. So a 30-year-old woman is currently pregnant at 28 weeks. So we're looking at one pregnancy already. She previously delivered twins at 35 weeks. That's another pregnancy. Both are alive and well. She also had 2 miscarriages at 9 weeks and 13 weeks. That's another 1, 2. What is our GTPAL? So from this, we're saying 1, 2, 3, 4. The Gravida is 4. Now, the term birth. If we look at this, she delivered the twins at 35 weeks and she had miscarriages. So 35 weeks is less than 37 weeks, so no term birth. So term birth is 0. Now preterm birth is 1. That's at 35 weeks. Now don't get confused with the preterm birth being 1. Even if she delivered it as twins, it's still counted as 1 preterm birth, just as 1 Gravida. Now, she also had 2 miscarriages at 9 and 13 weeks. So for the abortion, we are saying 2. Let's look at the living children. The first thing is that we know that she delivered twins at 35 weeks. And they said both are alive and well. So the living children is 2. So the overall is, the G is 4, the term is 0, the preterm is 1, abortion 2, the living children 2. Now let's look at example 2. First, let's look at the criteria G, T, P, A, N. We'll analyze it. We'll start with the G. A 25-year-old female is currently pregnant with triplets. So there's one pregnancy going on now. She previously delivered one baby at 39 weeks, another pregnancy. One baby at 30 weeks, another pregnancy. Who are alive and well. And one miscarriage at 11 weeks, another pregnancy. So total of this will give us 4. Again. 10 births. Now, the woman delivered one baby at 39 weeks. 39 weeks is a 10 birth. So we'll say 1 here. One was delivered at 30 weeks. So 30 weeks is preterm. That's another 1 here. She had one miscarriage at 11 weeks, so abortion will be 1. And the living children, she's pregnant with triplets. She delivered one at 39 weeks, one at 30 weeks. So 2 children are alive because it says they are alive. So living is 2. So the overall will be, the Gravida will be 4, the term birth is 1, the preterm is 1, abortion 1, and living children 2. So that wraps up today's topic on GTPAL system. If you find this video useful, please like, share this video, leave your comment, and subscribe for more educational videos. Thanks for watching.